Hey everybody, welcome back. Mental health assessment of older adults. This is chapter 38 in your book. This will be a short one. It should not take me long to get through, not near as long as the last one. This starts on there's no page number there. It'd be 745 in your book. And there's a lot of good boxes here, especially when we talk about like the mental health assessment for older adults. It takes up like a whole page and a half of going through and things that you might ask them. So I would really highly encourage you to go through that and look through it in your book to just kind of give you an idea of questions that they would ask during a mental health exam and whatnot. So some interesting facts I got from your book. Lifespan has increased from 47 years, 78.8. So right now people are expected to live about 79 years. Your book says the number of people 85 and older is projected to triple from 6.7 in 2020. So that's about, right now there's about 7 people to 19 million. I'm sorry. I was confused when I read that too. 6.7 million in 2020 to 19 million by 2060. So a lot of older people. I think we've heard about this coming for a long time, but that's a lot. 19 million older people, 19 million people over 85 compared to about 7 million right now. So that'll be a big increase. Normally, there's going to be some physical decline in older adults, right? That's typical of our bodies. Things break down. But no really change in important functions if you're healthy. Your intellectual function should be there. Production or productive engagement with life. Older adults should still be engaging with life. Some things that are common in older adults that I wrote down was depression, anxiety disorders, and then dementia is the most common. We talk a little bit more about dementia in chapter 20 or 39. I just did a recording of that as well. Sometimes this happens because of other comorbidities, like maybe they have diabetes or cardiac issues, and then this can cause some depression and anxiety. So this can be because of other things that they're going through. Your book said older adults are more likely to report somatic symptoms rather than psychological. What is somatic? Because you might know, I wish I was there to talk to you and actually ask you that question. So somatic is more physical. So they're going to complain about physical pain or physical changes rather than depression changes. Fatigue can be related to anemia, but it can also be a sign of depression. So that's a good example there. Someone might complain of fatigue and really tired, and we worry that they may have anemia or something like that, but it also could be a symptom of depression. So those are things to kind of watch out for. Technique of data collection. This is where that nice chart is. 38.1 changes that affect mental status. Actually, it's 38.2, sorry, but 38.1 does have some changes that affect mental status disorders in adults. So we're going to do interviews, self-report, maybe some lab tests. So acid-base balance may be off. Dehydration we talked about earlier could be an issue. Want to look at their medical record. What drugs are they on? Those could be causing some of these issues. Hypothyroidism, hypoxia, infection, sepsis. Those are all things your book listed out. Here's the mental health assessment of the older adult that I now mentioned 3 times. Again, on page 747. So this goes through several questions that you ask them and can help with a mental health assessment. They're also going to do a physical assessment, current and past health, a physical exam. We talked about this with the chapter 39 lecture as well. We want to talk about their pain. We want to talk about the drugs that they're taking. I feel like I've said that several times, but polypharmacy can be an issue with older adults. And, we're taking this drug because of this symptom, and now we've got this side effect, so we're taking this drug. So we really need to sit down and get their medication. Other things we might do for their mental health assessment. How do they deal with mental health problems? Are they in denial? Are they scared to admit any symptoms? There is a couple depression scales, and they talk about it on page 38.5. 752 talks about the geriatric depression scale. You don't need to know the different scales, but know that there are scales. And I really like this depression scale. It's about 15 questions. This is the short form. but they're just yes or no questions. So it's not asking them to really dive into anything. It's just asking them, for example, do you feel full of energy? Do you feel that your situation is hopeless? Do you feel happy most of the time? Do you feel that your life is empty? So then once you get all your points scored, then you can, it tells you where they land on the scale. So there's a lot of different scales you can use. Again, you don't need to know the different scales. I'm not asking you to memorize those, but just know that they're out there. And obviously, depression can be a huge thing for older adults for many reasons. A risk assessment. So we're looking at depression, past suicide attempt, firearms in the house, alcohol or substance abuse. Maybe they feel like they're a burden to their family. Maybe they're isolated socially. Social assessment. Do they have social support? Do they have family at home? Sometimes older adults don't have family around. Their functional status. Can they still perform their ADLs? What social systems do they have? We're hopefully going to look at, once we get towards the end here, some of the community resources. What resources are there for older adults? Sometimes there's not a lot. I know in my community we have a senior citizens center that they can go to, and they have bingo there and they have lunch there. They can eat lunch there for free. But I mean, if they can't get there, what other resources do they have? Their legal status, and what's their quality of life like? Assessment for the social domain. This is the last slide here. Again, social support. One thing I wrote down that I read in your book is we often forget that older adults have the same rights as everyone else, unless they're deemed incompetent. So I feel like older adults kind of get pushed to the side sometimes, but we have to quit doing that and make sure they have the right resources. So maybe working with, social work. Sorry, I couldn't think of the word. Maybe we're working with social work to help get them those resources before they leave the hospital. Or if they're coming into the clinic, maybe we're working with people in the community and social work to try to help get them the help that they need. Maybe they need someone coming in and helping with their ADLs. Maybe they need more community resources where they can get out and be around other people. So it's a really short chapter, chapter 38. Again, I highly encourage you to go in there and look at that mental health assessment, if nothing else, and then that depression scale, which is really helpful. That is chapter 38 for the week.